The material that I use to do this is made by GC, and it's called G-ænial universal flow. And let me start out by explaining that this is not the traditional flowable composite. This is injectable composite, and let me explain to you what that means. This can be used in any application, class 1, 2, 3, 4, 5, and 6s as I showed you. So any application it's fine for. When you first use this, and specifically when I first started using it, for a dentist, it's very, very natural to hold a syringe in your hand, considering how much we inject with local anesthetic. So it's got kind of a, what I call a natural ergonomics. The placement is very quick. Imagine injecting this into a cavity preparation, how easy that is. And that in itself eliminates some instrumentation. You're not manipulating the material as much with composite instruments. You can actually manipulate it with the tip of the syringe, the disposable tip, which again, it's just eliminating some of the instrumentation, some of the process that has to go into this, and it makes it much more user-friendly. I use this predominantly in class 5, 6, class 1 scenarios, and sealants. This is really the mainstay of use for me, and I'm going to show you about that. So this is really the first composite that we've seen that is truly injectable. So it has the wear of a traditional composite, yet you can inject it. And it polishes the way a microfill would, even though it's a nanohybrid. And that's because of a uniform particle size. And that's revolutionary, because as we know, our nanohybrids are strong, but they lose their glass-like finish after a few months of toothbrushing, and it becomes more of a satin finish. That does not happen with this material. If you compare it to, say, a product which is a flowable composite, G-ænial flow, and then G-ænial universal flow, which is injectable, the first thing that should be of notice is that the wear resistance is dramatically different. So typically a flowable composite, and speaking in a traditional way, that would not be a good choice to treat an occlusal surface of a tooth necessarily because of the wear rate. So here with G-ænial flow, you can see a wear rate of in the neighborhood of 16 microns a year. Now go to G-ænial universal flow, which is injectable composite, you're down to 3. So now you can quickly see why I'm using this on posterior teeth and on those anterior teeth, on those incisal edges with success, and you can too. As I mentioned, one of the features of this group of materials that GC makes, and again I'm going into the universal flow, that you have a uniform particle size even though it's a nanofill composite. So in the case of G-ænial universal flow, it's 200 microns. The G-ænial flow, which is the flowable version, is 400 nanometers, and then also the G-ænial sculpt is 300 nanometer range. So what's happening is when you're brushing, patient leaves, restoration's finished and polished into a glass-like finish, there is no plucking, if you recall, having large particles come loose and then having that surface become more satin-like, which is characteristic of a nanohybrid, but not of this material.